Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Will Kwasigroh, and today joining me is Jessica Barron. Jessica Barron is the outpatient clinical therapist at Pathways EAP here in Jackson, Tennessee. Jessica, how are you?
Hey, I'm good. How are you?
I'm good. Thanks for coming on today. So today we're going to be talking a little bit about COVID-19's impact on mental health. Now, obviously COVID has not been a good thing for the world, for West Tennessee, but not all of it has necessarily been bad. Off mic, we talked a little bit about what that means, and we'll talk about that here in just a minute. So I think we're going to start off by talking about different kinds of stress and like defining stress and maybe how people can recognize if they're stressed or if they're having mental health issues and they don't maybe not realize it, and ways to recognize that. So if you could just go ahead and like define stress for me.
So, I think it's important. I would definitely want to reference the previous podcast that you've done with Donald Jordan about COVID and anxiety and depression that people are experiencing and continue to experience.
Sure.
I just want to take this podcast a bit further with discussing what stress is and how your body reacts to stress. So as a trauma therapist, it's one of my things where I understand how bodies react and how your brain reacts to the stress or the trauma that you're experiencing. I just want to start out by defining stress, and it's basically the brain's response to any demand of, what's going on. How harmful the stress can be, it depends on the intensity and duration. So I want to start by discussing three types of stress, or three events. There's a short-term event, which is something that just happens, on the daily basis, something like an argument with someone. There's a long-term event, which is, having to manage a terminal illness or having a job that's really stressful. And then there's a chronic or toxic stress that happens and it's intense for a long period of time. And I think when we're talking about COVID, we're looking more at the long term and we're looking more at the chronic, because it's been a year, close to go. And I think
some change almost.
Yeah. So a year, and we're definitely looking at probably through 2022.
Oh, sure.
If what I've read is correct.
Absolutely.
So it's something that we're going to be continuing to deal with. There's ebbs and flows. Sometimes it gets worse and sometimes it gets better. I think now we're at that point where things are a little bit better, but we're still having that chronic stress of worrying about, our loved ones, about our safety, about our jobs, financial issues.
Sure, absolutely.
All the stress that we have triggers that are, physiological, which means body reactions. And some people don't understand what their body reactions are because they may not be in tune to it. So I do want to talk a little bit about those, but chronic stress is specifically problematic because it can cause significant harm to your body and your brain. So educating people on what am I feeling, what's my body telling me is important.
Sure.
So I always ask my clients, like whenever we're talking about trauma and we're talking about stress, how do you know you're stressed? Typically they're like, I don't know, because they don't think about that in their daily life.
Sure.
So I always go back to, what's your temperature like when you're stressed? What's your heart rate like? Are you breathing heavy when you're stressed out? What's your body feel like, your muscle tension? You have to pay attention to what your body's telling you. So when you answer those questions, it's going to give you more of an understanding of, okay, so these are signs that I'm not okay in this moment. So I need to do something to help myself cope.
Gotcha. So what are ways that people can cope with stress?
Coping with stress can be anything that helps bring down your anxiety level, your physiological symptoms, like listening to music, coloring. I mean, I'm 41 and I like to color.
Oh yeah, no, adult coloring books are a thing.
Yeah,
they're pretty great.
And then there's these apps that I love too, like Happy Color. I decompress using that, and you're just clicking on and you're coloring some kind of mandala type picture. And
right. Clicking on the number and filling,
filling the number with the color. And, you know, it's great because it helps you focus your attention on that one thing. So when you're focusing and you've got your mind off of the other stuff, gradually you're calming down. You're, you know, hopefully your breathing is getting slower and you're kind of coming back to your normal window of tolerance for what's going on. Cooking, gardening, listening to music. I don't know if I said that one. Any kind of sewing, you know, knitting, anything that's more of a physical activity, I feel like is the great form of coping because it's allowing you an outlet to get out the anxiousness that we usually get when we're stressed. I don't know about you, but I feel
like my muscles get a little more tense. You mentioned earlier, like the breathing gets a little shorter, maybe a little bit harder. Not necessarily harder to breathe, just the exhale is stronger, I guess. I'm a musician playing drums. I mean, that's kind of a very loud, forceful thing, which I guess some people might be like, well, you might be causing more stress by hitting something, but I like to hit drums, you know.
No, it's therapeutic.
Yeah, I agree, for sure.
I think because it's a method. That's what we say when we want you. It's a form of coping is releasing. So if you're angry, you're getting that emotion out instead of using it in maladaptive ways like words or, you know. I know one of the other things that we found is that drugs have been more of a factor for people that are struggling with depression and anxiety. So instead of finding alternative methods, you're using a positive coping outlet.
Gotcha. Okay. That makes sense. So it kind of sounds like, I feel like most everyone, if not everyone, has some sort of hobby.
Yeah.
Now, sometimes that hobby could be stressful. Playing drums for different bands can be stressful at times, but it's also the thing that I love to do, and it's also the thing that takes my mind off the stress of doing these things. So like maybe woodworking or like you mentioned gardening. Some people find stress relief in cleaning their house or scrubbing a pool or, you know, random kind of things like that. But
organizing for that cool
string art thing
that I'm loving.
Well, thanks.
Yeah.
So I guess my point in saying that is everyone does have something that they can do that can relieve stress. I guess you just need to identify it, maybe carve out some time. If you can't do it every day, you know, people are busy, I understand that, but try to carve out maybe at least 15, 20 minutes a day to be able to decompress. Is that fair to say?
Yeah, no doubt. I mean, even if it's just getting up and walking to the bathroom, washing your hands, washing dishes, you know, walking to the mailbox, anything that you can do to do your deep breathing. You don't have to make a big production out of it. Just to breathe in and then breathe out. And, you know, there's other types of meditation. Meditation is something that's good, and that helps with the breathing. That helps with you getting in tune with your body to kind of release. And, you know, there's guided imagery that we do in EMDR sessions where you're feeling and you're trying to relax enough to feel where's the tension in my body. And then we focus on that tension and we try to work through it with your feelings. So, I mean, there's a lot of things that you can do to cope appropriately.
Okay. So when you say you try to focus on the tension in the body, say like I hold tension in my shoulders, you say you try to identify that and then work through that. Now say I am holding tension in my shoulders, how would you identify it and then work through that?
Well, typically when we do EMDR sessions, EMDR is eye movement desensitization and reprocessing therapy.
Okay.
It's a form of therapy that we do for people that have post-traumatic stress disorder.
Okay.
So what we do is we bring up the image or the target for the trauma. And when you're thinking about it, you're feeling feelings and you're making a neural connection to the trauma from the past. So what that means is your body remembers the trauma, it remembers the feelings, it remembers the sounds, it remembers all of that. So you're connecting with the trauma and then you're feeling what you feel. So if you feel it in your shoulders, you know, we'll reprocess that memory with a positive thing so that we can allow you to feel some type of relief.
Okay.
And alleviate some of the pressure. So we'll continue to go back to where are you feeling it in your body now? What's coming up for you? And then you say it or you think it. You don't have to say anything out loud. You just let me know that you're good. And then, you know, we'll continue to process it until you're feeling better emotionally and physically.
Okay.
And then that lets us know there's a a scale that we use so that we know, well, it's resolved or it's not resolved. And if it's not resolved, we got to continue to do some work.
Gotcha. Okay.
But it just helps you allow yourself to be free from those feelings and those. It doesn't make it go away. You're going to have memories, but it's going to make that feeling and those thoughts is going to reprocess it in more of a positive experience.
How does one recognize, okay, say someone doesn't think that they've had any sort of like really big traumatic past experience, but they feel like they might have tension in their back and their, I don't know, in their arms or whatever, but they, like I said, don't think they've had anything like that. I don't know if I'm asking that right.
That makes sense, because a lot of people that you talk to have had really bad experiences, but they're used to it because they've lived it and it's just been a part of their life their whole life. Okay. So it makes sense that they don't look at it as, well, it's preventing me from being healthier. It's not affecting me like that. Because, if you compartmentalize things, it can allow you to deal with it when you're ready, or it can allow you not to deal with it. So you just put it back in that box on the shelf and you don't ever handle it. So,
it's
that's
there,
how you
it's just not being addressed.
Yeah, it's not being addressed. And then, what was your question?
Even if you don't think you've ever had any like significant past trauma, how do you know for sure if you have or haven't? And I guess it's not fair to say that everyone has some trauma. Some people very well could not have any. Is that fair to say, or is it pretty well like no matter who you are, you're going to have some sort?
Well, it's hard. I feel like we all have our stuff. And I don't think that you can, this is my personal feeling. I don't want to speak for everybody, but I feel like we all have something. And we all have something that we didn't cope with right, or we didn't handle right, or we're still thinking about it in our 40s. I mean, so I think that there's always something. Whether or not it's severe is another question. But yeah, I mean, everybody's got something. So if there's something that continues to bother you, you need to talk to somebody about it, because it can be affecting your mental health with anxiety, depression, and you can have trauma triggers and trauma reactions because of things and not even know it, like excessive behaviors or excessive reactions to things can be related to trauma that you just haven't realized or you haven't connected. Yeah. So I think, behaviors and recognizing those things are important.
So what do you say to the person who might be thinking, I was raised just to get over it, to deal with it. I don't need therapy. I don't want to go talk to somebody. I can figure this out on my own. What do you say to those people? Because I think this might be kind of weird to say, but I think especially in the South, that's a big thing. I don't know if mental health has been addressed. Certainly well on the way to becoming more of a consistent topic of discussion, but I think right now it's still in like the I don't need a shrink. I don't want to talk to anyone about that. So I guess my question is, what do you say to the people who are hesitant to really open up?
I mean that's completely legit. I mean, there's a lot of people that feel like, I'm good, you just deal with it and you move on. I would say, I get it, I understand it, but we all need help. And just because you need help doesn't mean that you're not okay. It doesn't mean that you're not strong. It doesn't mean that, you can't handle things. I mean, you're capable of doing it, but talking to someone, and that's what therapy can be. It's just an outlet to share thoughts and feelings and have somebody listen to you. And it's an outlet for somebody to listen to you and then give you feedback. Gotcha. Constructive feedback. We're not here to criticize you. Therapy is meant to be a safe place for you to feel comfortable sharing what it is that's bothering you without any judgment. So if you tell me something that happened, I'm going to be like, yes, I understand that you were raised, in a home where you don't talk to people about your business. Family business is family business.
Keep it in, yeah.
You keep it, but that's why we have confidentiality. Right. I'm not going to go run and tell something that you tell me unless, it meets confidentiality limitations, which is, you're going to hurt yourself or someone else, or anybody else is hurting somebody else that you have to tell. So, it's a place for you to come in, talk about it, and then be done.
Mm-hmm.
You can choose to come back and continue to process things because it feels good to let it all out.
Mm-hmm.
But stress has a lot to do with holding everything in.
Mm-hmm.
We feel it in our body, and not only are you mentally and emotionally heavy, but you're physically heavy. If you think about all the stuff that you're carrying and that you just stuff, I mean, it's exhausting and it's heavy, and it feels good to be able to talk about it and then leave it where it was.
Right.
And then you leave the session with more, I don't know, people say after EMDR sessions, I feel lighter. I don't feel like I'm weighed down on my shoulders. I don't feel like I'm heavy.
Right.
I mean, and that's an amazing feeling, to be feeling lighter, not only in your mind, but your body, because you let something out and it was a safe place and it was a great experience.
As cheesy or as cliche of a statement as this is going to be, it's literally everyone does carry baggage.
Yes.
So
yes.
it's a location to where you can leave that baggage.
Definitely.
So.
And it doesn't have to be, I experienced trauma and I need help working through it and getting past those thoughts, those feelings, and, all that. It can be as easy as, you know what? Life is stressful right now.
Mm-hmm.
My job is hard. Well, my home life is crazy because my kids are in and out of school. We're doing the virtual learning. I just need somebody to download to.
Yeah.
I just need somebody that's going to listen, that's going to validate me and tell me it's going to be okay. You got this. And, be a support, because a lot of people, and I think marriages and relationships right now, people don't have that support.
Right.
And because we're all dealing with the same thing in that one household, right?
Yeah, that makes sense.
So it's a place to just kind of feel better and talk about what you need to talk about and let it go.
Yeah. And I think with COVID, like, everyone is dealing with that at the same time around the world.
Yes, for sure. And I think, being in close proximity all the time and having to see somebody all the time, I think that it has hurt relationships because everybody is so close together and you don't have a break. And for people that are living in the same household and working from home,
right?
I mean, you need your time. You need your space. You need some, I call it me time.
Oh,
and
yeah.
I know it sounds selfish, but hey, we all need me time.
Everyone needs to be a little selfish on occasion. You have to take care of yourself.
Yeah, and that's part of you having appropriate boundaries and, for the mental health aspect of what do I need right now?
Right.
I just need some quiet time. I just need everybody to leave me alone and let me think and let me have a minute or an hour, whatever that means for you.
Right.
I think that's always a great way to cope if you're feeling overwhelmed.
I think it's important for everyone in the public listening to know that you're not alone on occasion. I mean, if you're working from home with your spouse or with roommates or whatever, physically you're not alone, but you might feel overwhelmed. But there are people out there who can help you. And that's kind of why we're here talking today about the Pathways program. Now, if you're an employee of West Tennessee Healthcare, there's a specific Pathways number that you can call, and I'll put that in the description of the podcast, and that's going to be called Pathways EAP, Employee Assistance Program. Is that correct?
That's correct.
And then if you're not an employee of West Tennessee Healthcare, we have programs for you guys as well. We have locations all across West Tennessee, and I can put the phone number to the main Pathways location in the description as well.
For hospital employees, Aetna, there's an EAP program. So hospital employees get 6 free EAP visits to talk to an EAP provider. That can be somebody at the EAP program, or that could be a provider from Aetna. And what's cool about it too is that your family members, immediate family members that live in your household, also get 6 free visits.
Oh, I didn't know that.
Yes.
That's awesome.
So, we recognize that everybody's struggling right now, and we want to make sure that is known, that you have outlets, you have 6 free visits for you to use the way that you want to, for your family members, for them to just kind of come and download with a therapist and just say, this is what I'm dealing with, and
I need help.
Yeah. Yeah.
So let's talk about the implications or the effects of COVID. Now, like I mentioned earlier, COVID was not great for everyone. Yeah. Whether you've had COVID, I can almost guarantee that everyone has known someone or does know someone that's either had it or has died from it, which is terrible. But not everything that's happened during this COVID time has been a negative thing. Do you have anything that you could talk about that's been a positive because of COVID?
Yeah, I was reading an article the other day about how, the pandemic has actually not been completely bad because it's kind of forced us to get out of our comfort zone. It's forced us to have a different pattern of how we live and how we communicate. The study talked about it buffering, bolstering, and building people's mental health. And I thought that was important because it's helped us grow personally and developmentally in a lot of ways. How we have bolstered mental health, we've had to social distance, but because we have social distance, our social connections remained intact. So the study suggested that the social connectedness played a bolstering role in maintaining mental health. So we've had to find ways to connect. We've had to find new ways of communicating. So whether that be online, FaceTime.
Zoom, FaceTime.
So, it's affected everybody's work situation.
In a way, it's kind of like forced everyone to quote unquote go into the 21st century.
Yeah.
Like people need people, whether they are people or not. People need to be around other people, whether it's online in a Zoom meeting or like heck, my family has even done like Zoom Hangout, Google Hangout or whatever. But my 80-something-year-old grandmother, she has never done anything on a phone like that until now.
Yeah.
So it's, I think, like I said, been able to push us into the 21st century, which I think is not a bad thing at all. I think it's pretty great.
I totally agree. I know my grandmother upgraded from a flip phone to a iPhone.
Same.
So, and we had to teach her how to send pictures, how to receive things, and it's been encouraging to see even our elderly learn how to participate in what's going on. So I do think that it's been a positive for families in work situations. Well, education is another one that it's changed because, with the universities closing, the colleges, I know I was at Jackson State doing therapy there, and we had to figure out, okay, how is this going to work now that everybody's off campus?
Right.
So, that's a whole nother aspect of being able to connect with people not in school. And, that was another thing that we talked about. Some people are more comfortable connecting and doing therapy from home.
Yeah.
They would rather do that instead of, be
in the same room with the person.
In the same room because of anxiety reasons,
right.
because of those things. So, we definitely want to be mindful of challenging people that have anxiety so that they get out of their comfort zone, because that's the only way that you can process appropriately through it is exposure therapy.
Gotcha.
So anxiety type behaviors and having the anxiety, the only way you can challenge yourself is through exposure therapy. It's uncomfortable, but you don't have to do it for extended periods of time. You have to build your window of tolerance.
Right.
So,
which kind of leads me to my next point of West Tennessee Healthcare and Pathways offering telehealth visits.
Yes.
I feel like the name kind of speaks for itself, but telehealth means that you can be really wherever and FaceTime or Zoom conference with a therapist. If you're one of these people who don't want to get out, who need therapy, but are maybe just not ready to go out the door yet. So, you still have options for therapy just through telehealth.
Definitely. We've had a lot of people that have enjoyed having the option to talk on the phone instead of coming in, especially our elderly population, because, finding rides, finding family that can bring you, and, sometimes they just don't feel like getting out. So it's been beneficial, especially, and now with people not having jobs, financially, it doesn't make sense for them to come all the way to Jackson, especially from the surrounding counties that we work with too. So it's been beneficial in many ways because you can do telephone and you can do Zoom. So when you build mental health, you're able to use the crisis in a transformative way. It occurs when the individual develops internal strengths such as self-compassion, self-awareness, and resourcefulness. And those are things that we've had to do.
Oh, yeah.
We've
Absolutely.
had to learn how to save ration food, especially if you can't get out to get it with the snow. I know that was crazy.
It was crazy.
Like
it's kind of fun, but it was kind of crazy at times as well.
Like the store there's nothing. It was like pre-pandemic.
Right.
Look, like the shelves are empty. So building strengths with yourself and, for yourself, it enhances the meaning and the purpose for yourself, and it improves your mental health.
We are in the midst of a pandemic. Since any of us have been alive, that's not really been a thing. There was the H1N1 that happened when I was in high school, but that never really reached the level that COVID is on. So there's obviously a lot of stress that comes with that of, well, is my family going to be okay? Am I going to be okay? So I think it's important to, like, give yourself some grace. I'm the kind of person that, like, depending on what I'm doing, I put a lot of pressure on myself. I know I'm not alone in that.
Yeah.
So giving yourself grace. If you ever watch the show Parks and Rec, treat yourself. You have to do that to be able to cope with things. So I tell myself this all the time, like, if I'm getting stressed out about something that I can't necessarily change, I'm doing more damage by stressing on it to myself when I should just give myself some grace and, allow it to happen and then move on from it.
Yeah, you do what you can.
Right.
I think that's the thing about feeling like we're in control and wanting control. We're never in control. We have that false sense of control. We think that we can make things better. We think we can handle it. When reality is, it's gonna be what it's gonna be.
Right.
You can do the what if scenario, but that can also make you feel more anxious and stressed. Or you can just say, okay, I'll handle whatever comes.
Right.
And then let it go. And I think that's the healthiest thing to do.
For sure.
It's difficult, but you have to challenge yourself, and you have to build that tolerance of being able to do it, having done it successfully. And each time you do it and it turns out fine, you're building a new neural network so that your go-to reaction could be, okay, I'm not going to worry about it. It's going to happen.
Right.
And it's going to be okay.
Right.
I'll deal with it.
Yeah, that's great.
So like you said, I think that, the pandemic it's made us grow stronger through this adversity. So that's another benefit to mental health.
I think it's going to be something that hopefully COVID, kind of dies down over the next, we'll say, year. It's still going to be a thing, I'm sure. But I think the lessons that we've learned from it, both physically and mental health wise, are going to be like coping mechanisms or lessons that we take with us for years to come. Like stressing over things. Obviously, we're not only going to be stressed out about things during COVID. You have life things. You have buying a house, hanging out with your kids, getting your kids to practice or whatever. Different requirements that you have to meet every week that can stress you out just as much, if not more, than worrying about COVID. So I think learning how you dealt with those feelings normally and then learning how you dealt with them during the time of COVID, it's going to do nothing but just help overall with the mental health once COVID is not as big of a deal.
It's a strength. It becomes a strength because, looking back to what our stressors were prior to COVID, I look back and I'm thinking, what was I belly aching about?
Right.
And now, we've had to be at home. We've had to change how we live. We've had to, not go to the grocery store and just do the online pickup.
Right.
It kind of slowed us down to be able to appreciate maybe where we were. Yeah.
I think everyone needed, I know I especially needed a big old pause button to happen. Everyone's got stuff going on. As bad of a quote-unquote pause button as COVID has been, in a way, it's, like you said, forced everyone to kind of slow down a little bit. And I think people are, in a way, thankful for that. I know I had a lot of things happening that I was like, all right, this is going to happen in May. This is going to happen in June. Okay, I got to figure all this stuff out. And then when the world shut down, it was more of like dude, I get to enjoy this time at home.
Right.
This is going to be great. So obviously COVID has not been a great thing, but on the flip side, some of it has been positive.
Yeah, it's challenged us to cope.
For sure.
And it's challenged us to learn to be okay.
But it's okay if you're not. There are people out there who can talk to you and work through things with you. If you are having issues, if you're not able to cope with things at home, if you just need a break from the everyday being at home, stuck there, give us a call. We want to help you. That's our job. People at Pathways and Pathways EAP, they're trained. They know how to help you. So like I said, the phone numbers to those places are listed in the description if you need it. I'll also link the website if you want to check out there and find out any more information you might need. So.
We have appointments on our schedule now for EAP clients.
Okay.
I've got one, I think, every day, at least one open. And if we need to get you in, we can definitely do that. So,
awesome.
You know, the help is here. We're ready to help and listen and do what we can. So please reach out, use it.
So Jessica, just to make sure I understand this correctly, telehealth visits and online visits are still going to be a thing. So you don't necessarily have to come into the office to receive therapeutic help. Is that correct?
That's correct. At this point, we have not, scheduled a time to come back into the office to resume doing face-to-face therapy sessions.
Okay.
Also, we do have providers at Pathways. So providers means that if you feel like you need help with coping and you need some medication stabilization for anxiety or depression, we do have providers, and they are doing teletherapy visits as well.
Okay.
So that means telephone calls and Zoom visits.
Oh, gotcha. Perfect. So
either way, you can choose which form of interaction you would like.
Perfect. Well, Jessica, this has been really great. Like we've said, if you're having issues, please give us a call. Pathways and Pathways EAP is there for you. You're not alone. You don't have to be alone, even if you feel like you are right now.
Definitely. And I appreciate you taking the time to let me come in and talk about, what we're seeing and what people are experiencing, and just letting people know that, you've got a resource.
Absolutely.
And we're here. Also, if you feel like you're having specific things that you need help with, we definitely have Pathways. We have the crisis and the triage. So if you need immediate help, that phone number will also be linked so that you can call the crisis hotline with the suicide hotline. And if you call the Pathways crisis line, you'll be able to talk to somebody in triage and tell them what's going on, and they can advise you as to what you should do next.
Fantastic. Well, Jessica, like I said, thanks so much for coming on, and this has been another episode of We Talk Health.